You are listening to Key to the Bridge, brought to you by your friends at Keystone Therapy and Training Services, where we will be sharing human stories, talking about community resources, mental health, and wellness. This is a podcast for everyone. Welcome. All right. Well, welcome to Key to the Bridge. I'm really excited. I'm always excited, I think, when we're recording podcasts. I'm just excited to talk to folks with an amazing community member and colleague, Tiffany Lacey, who I absolutely adore. And I'm really excited to have you.
Oh, thank you.
And I just respect and care about everything you're doing so much. And we are going to be talking today about caring for families and also really in the postnatal 0 to 5 community caring space. And you and I can chat a little bit about all the things that you're doing, because you're doing a lot of things and how things are going in that work. So I'm really excited that you're here, Tiffany, and thank you for coming.
Oh, thank you for having me.
I'm really excited. So I'm going to let you talk and introduce yourself a little bit and tell us about what you got going on right now.
Like Erica said, I'm Tiffany Lacey. I'm a doula in Sonoma County. I work with all types of families. I not only work in Sonoma County, I also service families in Marin County, Napa County, a little bit of Lake County. And what I do is I'm a doula for both prenatal, birth, and the postpartum space. I take clients who have Medi-Cal, which is a new benefit, which is awesome. That Medi-Cal covers doulas for Medi-Cal recipients. I'm also a TRICARE doula, so I take TRICARE insurance, which is military insurance, and I also have a sliding scale. So I really want to be able to support families so that they can have a doula. Anyone who wants a doula should be able to have one.
Tiffany, will you do me a favor? Will you explain to our amazing listeners, can you define what a doula is for folks, just in case anybody listening doesn't know what it is?
Sure.
Just in case.
A doula is not a medical provider. So a doula is very different than a midwife. Some folks get that confused. A doula is there to support families emotionally, physically, during prenatal times, the birth and or postpartum. So for me and my services, I meet with families prenatally, and we go over what they really want from their birth. We go over childbirth education, breastfeeding education. I help support them so that they can be informed and empowered during their birth. During the birth experience, I'm there as a birth coach. I help advocate for them in whatever space they are choosing to birth in, whether that's at home or a birth center or a hospital, which most of my clients deliver in a hospital. And I help support them physically. I can help educate them with different choices that come up during a birth, which during a birth, a lot of things happen.
A lot of things.
So I help with the choices that are set in front of them and help them make those educated choices. And then postpartum, I'm there to support them in those first few months postpartum that can be hard at times with breastfeeding, infant care, emotional support, and just there for them to just ask questions and talk to.
So I think about the work of a doula because personally, I fell accidentally into the work of being a doula, working out of high school and having teen parents on my caseload. And my first year working in the high school, I had 9 teen mothers. And what ended up happening is they would call me when they were on their way to the hospital or at the hospital. Now, this is before I had my own children. So I was in my early 20s. And so I didn't, and I do come, I'm the descendants of my great grandmother was a midwife. And so is my aunt. And so I've been around birth and babies. And so I was into it, but I just remember being called and they're like, can you come? And I was like, sure, what do you need me to do? Like, can you just come by? Like, I have questions, I need help. And their parents were there or guardians or whoever was with them. And I didn't really realize like that role, like until I was in it, and how important it is to have people who know you as the birthing person, but don't necessarily share DNA with you, right? Like they're not your family members, but also have some training in navigating and advocating and holding space, and if necessary, holding some boundaries for folks. And so literally I got done with like my third accidental birth attending, and I literally like just Googled, how do you help birthing moms? And doula came up, like this whole word. And I was like, well,
what is that?
What is that? Like, what is that? And then I'm reading it and I'm like, oh, okay. Like that's what this is. And I think that in midwifery care, the history of midwifery care, the doula role, whether that was what it was titled or not, is there was usually teams of like 2 to 3 people that went to help with the birth of a baby. And then even postpartum, your community had teams of people who came and like helped and supported you. And I just remember reading it being like, man, why is this not like a normal thing that like people are getting? And so I just, every time you talk about it, I'm like, like it's so important. So important.
It is so important. Especially the postpartum too. You have your baby, they give you your baby, you go home and you're like, well, now what?
Yeah.
Who do I call?
Yeah.
What do I do?
Yeah. And I think about the phone calls of having people call me and be like, okay, Erica, how long do I let the baby cry? Like before I just go back to the hospital. And I'm like, that's a really great question. If you've never been around a crying baby 24 hours a day,
right.
Like these they seem really like simple things, but the isolation piece too of how you go home now is like is super different. And so I just, the gift that it can be a challenging gift, but the gift of being the person along the ride as a family is happening and being created in some ways. Because if it's their first baby, it's your 10th baby, it doesn't really matter. Like there's shifts that happen
absolutely
in the community, in the family when you have one. So tell me about, you said Medi-Cal, and then there's some other projects that you are involved in right now in the growing support of how we want to help families.
Yes. I'm part of a new program. I'm the program director for Sonoma Heals. Sonoma Heals grew from Solano Heals. It was a program that started in Solano County for Black families and helping to change the statistics of the Black maternal health crisis that we're having in this country. So that program started. We wanted to start something here in Sonoma County. And with the funding of First Five, we were able to get Sonoma Heals. And with this program, they also have a doula program, which trains more doulas.
A doula program. Okay, trains more doulas.
Trains more doulas so that we can support more families. This program specifically trains Black doulas so that we can have more doulas of color in Sonoma County, because there's really not that many.
I think like I know there's me and you, but I don't know. I know there's a couple more, but there's very few just doulas of color in general. Like regardless of your background, it's not a common thing.
Right, and it's something that's important. I had my son when I was 23 years old. I was a single mom. I was so blessed to be able to have my son at the birth center and the Santa Rosa Birth Center that was there, and the support I got there was wonderful. However, the only person there to support me was my mom, and I love my mom. God bless my mom, but she is no birth coach. So it would have been nice to be able to have a doula, and that was kind of what sparked me to want to do doula work, is the birth of my son. It was long, it was hard. I was a single mom. I luckily did have family support, but I still felt alone, and it would have been nice to have somebody there with me. Yeah. So that's why I specifically wanted to be able to support families, all types of families.
Yeah.
Specifically families who may not have access to a doula. Before the Medi-Cal program came out, I still was doing doula work on a sliding scale, because having somebody in the room with you and having someone in the room with you that you can really connect with, whether that's someone who was also a single mother or somebody who is, maybe the same skin tone as you, somebody who's familiar, I think is really important.
It's super important. Will you tell me a little bit more about our maternal outcomes here in Sonoma County? I'm making an assumption for Sonoma Heals, there had to be some justifications for why the program could happen. Is it just Black family outcomes, or is it people of color outcomes in general?
It's people of color outcomes in general. It's really hard to drill down with the individual numbers because you're relying on data of someone filling out a form. Yeah. And not everyone is going to check that quote unquote black box, when you go in, because it may put you in a category you may not want to be in, coming from that experience myself. So we are just looking at general outcomes of people of color. Sonoma County, our numbers are not as low as other parts of California and other parts of the country, but it's still really important to be able to have doulas of color be here and support families. And the more doulas we have, the more families we can serve. And I like to tell all my clients and other doulas too that not every family is for you. Not every doula is for every family. Right. That's why if we have more doulas, we can be able to build those connections that really count for those families, and they'll be able to have more choices to really click with somebody to be able to support them.
Yeah, I just think about how complex it is, even just with getting access to care. You're talking about the forms, and it makes me itch, actually. It makes me itch. That I think about those forms and how narrow they are. I remember having to fill out some forms with my babes, and basically it was whatever I put down as my ethnicity, that was also basically the baby's ethnicity. There wasn't any how you would delineate between that information, and it got me thinking, I'm this data has to be not right because
it's not
very accurate. And I know all forms and systems are trying to work on getting a little bit better at that, but I just think about how inaccurate some of that data probably is because people aren't feeling comfortable to be honest about what they need and where they come from and all of those types of things. Right.
And the prenatal birth and postpartum time, that whole perinatal time, you can feel really vulnerable too, no matter, what type of situation you're in, let alone if you're in a situation where you may be less supported or alone or unsure how you're going to move forward, and being able to get resources to people who need them at this time and space that they need them is important. That's part of, what I do. If people ask me all the time, is there, do you have a referral for therapy services? Do you have a referral for food services? Do you have a referral for breastfeeding support? So that's part of what I do, is connect families to the resources in the community that they need.
Okay, so lay it out for me. If you are, we'll start with Sonoma Heals, because you're talking about that right now. So for Sonoma Heals, the goal is to train doulas. How many are you hoping to train? I would say a million. That'd be great. But how many are you hoping to train?
They started their first cohort of doulas, and there's 10 that have been trained, and they have their certificates. So now they just continue their training. They have their main doula workshop training where you kind of learn the basics of being a doula and childbirth education, and now they continue to train them. They help them get matched with families so that they can get their experience and their birth, so that they can also then help these doulas become Medi-Cal doulas, which is a whole process in itself.
Yeah. What kind of certification do you need to be a Medi-Cal doula?
You don't need any certification. They have 2 pathways, which was really nice. There's one for a training pathway. If you've gone through a training program, there's no specific training program as long as it meets the requirements, so many hours, and, the type of education that's behind it. And then there's an experience pathway, especially for those doulas who've been doing it for years and years, who don't specifically have a certification, because it doesn't take a certification to have to be a doula.
No.
It just takes the right experience, the right attitude, just being there in the space.
Right. Yeah. And if you were going to get supportive training, that would be awesome. Maybe like as you're learning, but it is tough. The certification process is cumbersome.
It can be. It can be cumbersome. That's part of...
And expensive.
And that's part of the Sonoma Heals and the doula program, is being able to train more doulas, and it's free for them for the training.
That's super great. Okay. And and then you have 10. Awesome. And how many cohorts do you get to do?
They have 2 so far.
Okay,
based on the grant that was
great.
given. Yeah, so they'll do 2 cohorts. I'm the director. They have a separate doula trainer, and then there's also a director of community support. So the director of community support and myself, we work together to be able to get the word out there, to be able to host community meetings, and kind of be able to have people know that the program is out there.
Yeah.
And with that, also that the Medi-Cal program is out there. That's also my aim at being able to talk to more people, that if you are a Medi-Cal recipient, you can have a doula.
Okay.
You can have a doula.
That's exactly where I was going. So just keep going. Tell us a little bit about the history of getting doulas on Medi-Cal, because that was a little bit of a process. I've heard that it was a process to even get them considered as a Medi-Cal eligible service.
Right.
And then, Tiffany, I also think I heard like you were the first Medi-Cal approved doula in the state of California. Is that true?
I was the guinea pig.
Say it louder. Say it louder. You were the first. That's so amazing. Okay, you were the first guinea pig. Oh my God. Okay, yeah, that must have been
They got tired of hearing from me, but we got it. We got it right.
Worked out. Okay, so tell me both parts. Part 1, how did they get Medi-Cal listed as a service? Like, what type of advocating had to happen for that?
A lot of advocating. The evidence behind doulas is there, and it's been there for
a long time, right?
So getting Medi-Cal to be able to say, hey, yeah, we should consider doulas and pay doulas, was a lot of lobbying, a lot of meetings, and it was a rumor for a really long time. And there was multiple meetings that happened, stakeholder meetings. They continue to happen in order to continue to move the program forward, because the program is still changing. It's still moving forward. They're still adding services. They're still doing all kinds of things to be able to make the program sustainable for doulas, because being a doula is a sustainable career. And I think a lot of people don't realize that too. Being a doula is a career.
Yeah.
You can do this for a job.
You can.
It's the best job ever. Being
great.
woken up at 2 a.m. is not always great, but, it's wonderful.
Then you get around those families and those
Exactly.
babies, and you're high for like days.
Exactly. So with Medi-Cal, they started... Well, TRICARE had done it first. So they had this pilot program, and it really worked. So I think that was part of what Medi-Cal kind of looked at and said, oh, okay, it's a program that can work. So it started in 2023. The program came out. I put in my application on, I think, January 1st or 2nd. And
yeah, you weren't playing. You were ready to go.
No, I was ready.
Yeah.
With the help of the Santa Rosa Birth Center where I was working at the time, we were like, let's do it. Let's see if we can get this done. And I did my application. I was approved by like January 7th. So,
wow.
I was the first. And from then on, once you're Medi-Cal approved, you also have to become contracted with each managed health program. So that's a whole nother thing in itself. But
which other health programs do you have
there's
to?
partnership and Kaiser. So those are the main two pretty much north of the Golden Gate.
Yeah.
Getting into Southern California, there's like so many.
Yeah.
But luckily up here, there's pretty much those main two that you also have to be contracted with. And then once you are, you're able to take those clients. So anyone who's on partnership, anyone who's on Kaiser Medi-Cal can have a doula.
It's just so cool.
And not only just a doula for your birth, they get 9 total visits and the birth itself, and 2 3-hour postpartum visits is the benefits that they're entitled to.
So 9 prenatal, like pre-birth
Those 9
appointments?
visits can happen in any combination of prenatal or postpartum.
Okay, so you have 9 visits, you have the birth, and then there's 2 3-hour postpartum visits. So you technically have like 11 visits.
Right. And if you need more visits, you can go back to your medical provider or any provider that is licensed, and they can give you another 9 visits. So a few families I've had get all the visits.
I'm shocked. Sorry, I'm processing.
It's a lot of support.
Yeah, that's 20-ish visits potentially. If you got approved for the second batch. Wow. And so okay. I'm like also feeling a little jealous because that sounds amazing.
Exactly.
It's such a gift to have somebody helping take care of everybody while everything's happening. Especially you're talking about populations too who have also all of the other contributing factors. So will you tell me a little bit about the demographics of the families that you're predominantly serving? Because if you're Medi-Cal eligible, you have to be Medi-Cal eligible, which is a whole thing in itself.
Right.
So we are talking about people who financially generally are probably in a different socioeconomic status. So how is it going with the different, communities that you're working with?
Yeah, predominantly the families that I work with may have a lower income, may have some food instability. I work with a lot of single parents, and that just kind of is a place close to my heart because I was a single parent, and that can be really, really hard. So that's kind of the basic demographic.
Yeah.
And a lot of times, most of the time, it's first-time parents.
Oof.
So definitely get second, third, fourth-time parents as well, but predominantly first-time. So it's completely new to them. The pregnancy may be unexpected, and they're just trying to figure out how to juggle everything, how to juggle finances, how to juggle food, how to juggle childcare, which is huge. Especially right now, the lack of childcare is a little scary.
Yeah, infant childcare is almost impossible to find.
Yeah. And take that and juggling going back to work and a job and all those things. And what are you hearing from the people you're serving about their experience with having you in their lives? They love having a doula. They absolutely love it. I've had groups of friends. I've had sisters. I've had, friends of friends of friends. So once kind of one person has heard about it, they tend to be able to tell their other family members and friends about it. And so that we know that the program is out there because people really want the support. They really want the support. Sometimes they may not feel they need it right away, but they're like, oh, I've heard doula's cool to have, and it's probably a good thing to have, so that's why I'm calling you. And then it turns into, oh yeah, we absolutely needed the support.
We absolutely need it.
Because when you birth in a hospital to anywhere, you kind of are on your own for the physical and emotional support. Because medical providers are there to be medical providers, to take care of you, to have, your interest in mind, your medical, your health, all of that. But they're stretched thin too. Nurses are stretched thin. Hospitals are busy. So being able to have that one-on-one support from a doula, and I work with the medical provider as well. Like I really feel part of the team. So we're able to be a cohesive unit along with whoever's birthing, to be able to educate them about their choices so that they can feel that they're empowered during their birth. I think that's the biggest thing that is so important when giving birth, is that feeling like you're in control, you're empowered, and you feel like the choices that you made were for you, and that things were being done with you and not to you. And I think that's the number one reason why people want a doula there, is just for that advocacy.
Mm-hmm. And like, what are you noticing too with, you said single parents, but people who do have partners or, family members who are with them? Being in the doula role and then also having my own children, I noticed how important to the doula was to my husband. Mm-hmm. And I think that that's something, whoever that other person is, who's going to be, those people who are going to be helping also with the caring of the birthing person post birth, right? There is something very important that the doula is doing for those folks, because stuff happens to them too. Yeah. and their level of responsibility and things that they're doing. And I do think I know we're always working on the research, but I have been thinking about that research around too, what does a doula do for whatever the community unit is mm-hmm. of the group, because it's huge.
It is.
It's huge.
Education with prenatally, I always like to meet everybody who's going to be involved in that space, so that I can answer their questions too, mm-hmm. because being a partner on the sidelines can be what is happening? Why are they making those noises? Why are they moving that way? Yeah. Being in the hospital, there's machines beeping, there's things coming in and people coming in and out, not sure what the next stage is, what's going to happen next. So being there to be able to reassure them mm-hmm. and explain to them what's happening, and also help them to be able to help their loved one as well. So, you can squeeze their hips this way, you can rub their back this way, maybe say this to them, offer water. So being able to help educate them with how to doula their loved one. I don't take the place of anybody. Yeah. I'm just there as someone who is a resource.
Yeah. Helping kind of hold it together a little bit while all the pieces that are there. There's so many things going on.
There's a lot of things going on. There's a lot of equipment. There's a lot of people. There's a lot of things. And birth is completely, it can be unexpected. It can be, I don't want to use the word chaotic because it shouldn't be chaotic, but
it's like a facilitated chaos.
Right.
It's not organized, but it's usually facilitated in some ways. There's some chaotic parts, because you're on whatever time you're on. You're kind of just winging it in some regards too.
Right.
Okay,
you can't totally plan a birth.
Nope.
You just kind of take what comes, yep. and being able to kind of help them along for that experience and explain to the partner and whoever's supporting them what's happening. Because a lot of times there's maybe the grandmother there or someone from a different generation who had a different birthing experience, and this may be the first birth that they are having since their birth that they are a part of. So, this is how it used to be, and this is how it used to be. So being able to explain how things have changed for the better in some,
we hope,
areas, and maybe not in others.
Yep.
But being able to explain, the differences so that they can really understand also, and putting them at ease, because they can be seeing your partner, your loved one in discomfort and pain, and maybe they may be a little uneasy. It can be hard.
I guess I'm also wondering too, just because I think it doesn't ever get discussed enough. Can you tell us a little bit about the maternal health rates? There's some national stuff going on, and if you know anything about too, what's happening in the state of California, how we're doing, because I know our grading as a country is not very great.
Right.
We're not the best. And
a lot of those really numbers are mirrored in California. Okay. Yeah. So I don't have the specific numbers.
No, it's okay. You don't have to cite anyone, but
they can still be, 2 to 3 times as high with just the maternal morbidity rates, and also
For women of color.
for women of color. Yes. So
2 to 3 times more likely to have something not go great.
Right.
Which is fascinating to me that happens. I know it sounds weird to say fascinated, but it is fascinating to me, like how it happens. And I don't think that part gets discussed enough, because it doesn't happen usually in like an instant. It's like it happens in stages of their care usually, where the outcomes could have been different.
Right. I mean, even if at the end we, quote, have a healthy mom and baby, there's still things that have happened that can create a negative birth outcome emotionally as well. So not every birth trauma is physical. It is emotional too, and you carry it forward and you carry it in your body as well. So both targeting the physical negative outcomes, but then also the emotional negative outcomes that happen as well.
And share however you would like to share, but I'm wondering, like, in your observations, like, what are some of the areas that maybe need improvement with the physical medical care first, and then some things you're noticing that could help with the emotional and like mental health care of people birthing?
I think listening to the person over the machines, I think, can be
helpful,
definitely improved. In Sonoma County, I do believe we are really lucky. Our hospital systems are really great here. I really have positive experience in all of our hospitals.
Yeah, they're working really hard. They're working really hard.
However, the overall policies that come from not just the hospitals, they come from, these other governing bodies.
The American Obstetrics, blah, 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 blah,
blah. That make things really hard. Even having intermittent fetal monitoring can be really a struggle in the hospital, because maybe it's not as convenient to be able to have that. Or, hey, I don't want this type of pain management, please don't offer it to me. I think there's a lot that can be said about treating the person, not the machines, and being heard. I think that's the number one thing I hear from clients is, I just want to be heard, and I want my wants and needs to come first, even if it's maybe outside of their specific policies, because policies change from week to week, month to month. I may know the policies of that specific hospital, and then all of a sudden things change and we're like, what? Okay, well, now we have to pivot because that policy is kind of outside of what that person wants.
And do you think clients have what level of understanding do you think your clients have, like, of their medical rights? Because that's something that, I know for myself, I've had to take a deep dive on, and really understanding, like, what my right is. And so how do you feel that goes usually with clients? Like, because a lot of people, I feel, maybe not want to make too big of an assumption, but I've observed, like, don't usually know that they have choice when they have it. They don't know.
Right. A lot of people don't. They just say, well, whatever the policy is, whatever they tell me to do, I'll do. And people will ask me, well, like, how many cervical checks do I have to have? I'm like, 0. You can have 0 cervical checks. It's your body, and you never have to have anything done to your body you don't want done.
0 is the answer.
Yeah.
They're like, what? They're like, yeah, 0.
Or do I have to have this, or do I have to have that? And it's like, you don't have to have anything.
Nope.
I've had people in an induction that just wasn't working. It was just for an elective induction. Like, you want to go home? Or we can do that? I said, yeah. Hospital's not a prison. You can leave whenever you would like to leave. You can say no to anything you want to say no to. The medical staff's job is to educate you so that you know your different choices, and to be able to explain the options and the outcomes. And that's also why I'm there as a doula, to be able to explain the pros and cons. But ultimately, it's their decisions what they want to do. And it's their body, and they don't have to have anything done to their body that they don't want done. So...
Yeah, I don't think that gets said enough. I could just have you saying that on repeat. I could just record you. And like, all I got to do is go to the doctor and hit play. This is what you say. You just hit play. Tiffany said it. Play. Because it's real. It's super real. And I think I think about they call it white coat syndrome for a reason. Because it's a real thing. Like that happens to your body when you enter a medical center of any kind.
Yeah. Your heart rate goes up.
Yeah, everything.
Your blood pressure goes up. You're immediately kind of like on guard. I think partly is because we're trained to go to the doctor when we're sick, when there's something wrong. Yeah. And that's not what pregnancy is. The majority of the time, there's those cases when, different outcomes happen. But for the majority of a healthy pregnant person, you aren't sick. Yeah. No, you're. It's about consent in any situation. So
that's another thing we should put on repeat. It's consent in any situation. Wow. Yeah. No, I just think that when you're getting to live in the spaces you and I are in, we're like, and we're like, advocating for those things. And then I realized that is not what's on repeat for people. It's just not. And that's part too of the role of the doula is like to be the sentences on repeat. Like, okay, no, I'm gonna tell you this 10 times. Okay, before the nurse comes in.
Right.
Let's go. What are we gonna, and so
asking too, hey, can we have a minute to talk amongst ourselves about it? And excusing the medical staff to.
Oh yeah, they can leave your room. Yeah. I think people forget like, no, they can go. You can tell them to leave. And people are like, what? Like, yep, you can have your own private, I can leave. I'm your doula, but if you want to talk even without me here, I'll give you some privacy.
I've left too. Yeah. Like, hey, I think that it's best that you guys chat and then call me back in if you want more information. Yeah. But ultimately, this is your choice. Yeah. And what I'm there for is most of what I do is education. I love educating people about choices, about outcomes. I have all these little educational tools in my doula bag that I can give people.
The magic doula bag. It's it's a real magical bag.
Mary Poppins bag. It's huge. I look like a pack mule when I go into
you're ready.
Hospital.
Well, you don't really know too. Are you going to be there for 5 hours or 3 days? You don't really know what's going to happen, so you got to come ready.
A bag full of Uncrustables, my favorite birth snack.
Oh, so, Uncrustables are delicious. Are you a strawberry, a grape? Do you care what kind?
Either one.
You don't care what flavor. Okay.
Whatever's on sale.
They're delicious. They're so good. I guess I'm wondering too, when you talk about this experience and you're talking about the emotional side of it, I think what you're saying in people having those types of experiences when they have felt safe and empowered versus when they have not, you're on the front lines of seeing the different outcomes of what happens to people then when they go home, or even just after the baby's born in the hospital, how those experiences could be a wide range of different depending on how they were treated.
Right.
Yeah.
And the type of birth they had. Some births are really long, some are short. Either one, and your brain's in a different spot when you're giving birth. So being able to, that's kind of what we do on our first or second visit postpartum, is talk about the birth experience. I keep my extensive notes that I give them after their visits or after their birth. It's this is the timeline of your birth. This is what happened. These are all the things, so that they kind of have this record, which I think is really cool to have of your birth, the kind of play-by-play, and be able to kind of talk them through their birth, and if anything came up that they may have felt kind of I just want to talk through that, or that didn't feel good, and being able to help them after the fact as well, and help connect them with resources if they need to talk further about it and past what I can kind of help them with.
Yeah, I think it's funny because what happens after you have a baby is people will come to your house and they'll be like, well, tell me about the birth. And you're like, well, first of all, I'm still processing it.
Right.
And second of all, no one wants to tell a story, even if it was the most amazing thing ever, on repeat.
Right.
It's an interesting culture we have about anything that's really big or exciting or even awful or traumatic. We ask people to tell the story. And so when I go over and visit people, I'm like, hey, how can I help?
Right.
And people are like, what? I'm like, well,
you don't want to hear the story. You don't want to
I don't
hold the baby. You don't want to you want to do my dishes or take my trash out.
Yeah, I'll do whatever you want. How can I help you? And I can also just. Or sometimes two people just want to be around folks, but it just kind of be quiet and be around people. And people are like, "What?" And I'm like, "Yeah, I also don't really have to talk to you if you don't want to. I'm here,
just sit here and hold space with you.
Yeah, or we can watch a show, or you can take a nap, or whatever. I don't care. But I think that is another culture shift that we're going to need to work on in the postpartum period. Is that it's about the nesting. That word is really good. We're supposed to be nesting these people and not overstimulating or
making them host a bunch of people.
Or they're not there to process your trauma. That's the other thing I've witnessed is people start telling all of their stories. And I'm like, this person just had a child.
Right.
Yeah. This partner in here too also just witnessed. Can we just not do that?
Right.
Talk to somebody else.
And be there for the partner as well, because depending on how births go and what happens, they need their space to be able to talk as well. Sometimes it can be kind of a whirlwind for them, no matter what happens, even fast births that, are very precipitous and just maybe we barely got them to the hospital and the partner's like, what happened?
I don't know what happened. Yeah. Lots happened. I do. I just think that too, being with families postpartum, and that could be 3 days or 3 months or whatever. That first year in particular, I think there is a kind of a recalibrating of the nesting and the supporting of people that we need to work on, because the mental health outcomes of folks with small kids right now are also not great.
Right. And that's one thing about the Medi-Cal program is that those visits are good up until a year after the birth. So I have followed families for that full year, and there we are on baby's first birthday and kind of wrapping up our postpartum period together, which is awesome because a lot of family come first few days, first few weeks, and then it's oh, okay, well, you're good now.
Yeah, the down tapering of support happens. And I always used to joke, people are like, "Oh, well, how could I help?" And I'm like, well, I really could use some help at 3 a.m. But nobody's going to be nobody really shows up at 3 a.m. And you don't want to ask somebody else to show up at 3 a.m. because we don't have community in that way. Right. We don't. And so I do think we have to start reimagining that a bit, because people have, and they go back to work.
Right.
Going back to work is also huge. I'm assuming, are most of the families you're supporting, are they getting 12 weeks, or a lot of people at the 6 and 8 week mark of needing to go back to work?
Most take that 12 weeks.
The 12. Okay.
Right.
That's good. That's better than 6.
Yes. Well, I couldn't imagine going back at 6 weeks.
No, there are people who that's what they have to do. Right. I'm like, that's nuts. Well, I guess you got to do what you got to do, but it still
can be very hard.
Very, very, very hard. Okay, so everything you're saying, Tiffany, is just mind blowing to me, because I don't know what rooftop we need to shout on top of together.
All the roofs. All
the roofs. Because I just think if Medi-Cal and TRICARE I'm assuming the TRICARE plan's similar to them.
They're a little bit less. It's 6 visits only, but they also have a separate program for breastfeeding support too. So a little bit less than Medi-Cal, but still helpful. So I just think that how people know what they have access to is also a massive barrier. I just don't think people know what they can get. And I think about medical providers. Right. They need to know.
Yeah. So I keep wondering too, how, I'm dreaming over here with you, but how we're going to get in front of more people who have, the touch points of folks, especially if you have Medi-Cal, what you have access to at this point. And then helping Medi-Cal, I wish too, blazing the trails for the fee for, the insurance companies you pay for out of pocket.
Right.
Insurance companies or whatever. We need to get them on board too.
Yeah. Kaiser is going to start having doulas paid for in 2025.
We'll believe it when we see it.
There's not a whole lot of details about it. They just kind of came out and said it. So to be kind of determined.
Mm-hmm.
And I know there's definitely more and more insurance companies that have it as a benefit. They do have to pay out of pocket first, which is a bummer. But I do see a lot more growth in insurance companies and employers also offering it as a benefit.
And then what do you think are some of the things that doulas are going to need for like ongoing support? Because you're right. It 100% can be a part-time job or a full-time career. It can be any all of those things.
Right.
And what do you think we need to do to support doulas? Because right now I'm noticing there's also
Community.
Yeah. I'll sing it with you. Community. Because I don't think there's necessarily a plan. There's not really a plan for providers of all sorts of kinds in general, but I do think about that role in particular because our systems, regardless of what they say, are going to value it differently because it's not as many pieces of paper and it's not as many of letters after your name and like all that other bouginess.
Still just as many pieces of paper you got to send in.
I know.
At the end.
At the end, it's the same. And so I just worry about like the support, right? Because you're going to, in that role, you come up, even if people being warm and friendly, you're still in between the medical system and like caring for a family. And then there's the experiences that happen. So I'm just wondering, like, what are something community? Okay, cool. What kind? What would it look like? What would we be doing?
Well, community of doulas.
Yep.
To be able to support each other, cover each other. We get sick. We have things happen.
We might want to go on a vacation.
Take vacation. We have kids and families, and also so being able to cover each other, having that Medi-Cal, be able to support that as well. There's not a great support for billing when it comes to that.
Like if you don't do it or you miss something.
You can basically, if I am ill or I can't go to a birth, I can only have another Medi-Cal doula go to that birth. So I can't have someone else outside of that because they can't bill for it. So that's hard, that system. But if we get more Medi-Cal doulas, then, we'll have more of a community. I think education to the medical providers to know that the doulas are here. We're here to work with you. We're here to work as a community so that they know what a doula is, how it's helpful. I think the individual hospitals here are great with the L&D units and all of that. I think it needs to go beyond that, though, to the security guard who's like not letting you in to the building because you're, who are you? Who are you supposed to be here? That kind of thing. So being able to educate more people on what a doula is and have a support system that is supportive of doulas. So not only doulas themselves be supportive of each other, but then also being seen as part of the team at the individual hospitals and in the birth space. Yeah. I mean, usually when you go to a home birth or a birth center birth, you're automatically part of the team, but hospitals a little bit different, and having education there as well.
Man, okay, I feel like we've like lengthened a to-do list of things we need to do, but I think but I do think it's helpful that we have some support now that feels more concrete in some ways. Like it's like, okay, this is here. We want to use it. What does it look like? How are we going to get everybody on board? And I do think the medical providers too, that we're there to help. I think that that's also something too that needs more education. That if we all do what we do really well, that in general, like the data shows, like the outcomes are just better for everybody all around. And then I'm wondering too, how do you feel like as doulas too, you absorb a lot of the experience of like what's going on. So how are doulas like decompressing and taking care of themselves? I mean, yes, being in community, but are there some other ways that doulas are coming together to help each other? Because it's a lot to hold.
Right. Individual kind of meetings. I host a couple trainings to be able to get Medi-Cal like more doulas on Medi-Cal, so I actually help with the training because it's a long process. So I help them with that. And with that comes more community of doulas where we can kind of like call each other and say, hey, this came up. Can I talk to you about it?
Yeah.
Or I have a particular client who's going in for an induction at this specific hospital. Do you have any tips about it?
Yeah.
What I always encourage people to do is after birth, like, don't do anything that day after. Just don't. Just be with yourself. Have self-care. Don't go to a bunch of appointments. If you can have someone else pick up your kids or order takeout, just kind of let yourself be, because it can be a lot.
You were at a birth. Like, you shouldn't. Yeah, like, that was your thing for the day. If you attend a birth, check. That day is done.
Move
you shouldn't
any
have to do anything else. Yeah, you're not doing anything else.
And people will understand.
Yeah, I do, because I do think too, doulas are going to have an opportunity to help in the, just say, early family medical systems, to think about too how we're going to care for providers, because we want everybody to stick around.
Right. We don't want burnout of both doulas and medical providers. I know, nursing, that's a whole nother conversation, but the burnout rate is really high. So being able to make it sustainable for everybody to be able to take care of birthing families, but then also take care of ourselves as well.
Well, I think that's like a great way to wrap up. We got to first take care of ourselves so that we can take care of everybody else.
Exactly.
Which is super important. Tiffany, I thank you so much for coming today. And I think we just need to keep talking and keep staying in touch with each other, because things are going to keep growing and changing.
Absolutely.
Okay. Well,
thanks for having me.
You're welcome. Thank you. You've been listening to Key to the Bridge, a podcast brought to you by your friends at Keystone Therapy and Training Services. I'm your host, Erica Bosky. Key to the Bridge is recorded and produced by Jeff Henderson and Brian Henderson. This is a podcast for everyone.